Hello, I'm Dr. Deepak Devakar. So, what is frontotemporal angle? The hairline is the foremost line of your hair which is defining your face. This will be from the one corner of your hair to the entire other corner. So, the frontotemporal angles are the angles which are created by the frontal hairline and the sides. So, this angle, which is what gives this baldness appearance once it starts. In the initial stages of baldness, there is a grade 1 of androgenetic alopecia where some receding of angles will happen in the temple areas. So this gives an appearance of baldness which is starting. At stage 1, it is not significant. So at some age, at around 25-30 years of men or after 30, most of them develop some amount of receding hairline which is natural. If it starts at an early age, then it is not good and it has to be treated to stop further progression of baldness. Frontotemporal angle correction can be done with surgery, but you'll have to decide the correct time to undergo a surgery. It is always preferable to save your existing hair to avoid further balding process and then go for transplantation to give a natural hairline. Frontotemporal angle correction, if it is done at a very younger age where they are still progressing into baldness, then it creates hairline which is not natural for the age in future. So the hair transplantation will be done from the back of scalp, which are permanent hairs. These are not affected by baldness, because of which if they are transplanted in the frontal angles and corners, these hairs will remain only here, and if the existing hair starts to recede and get bald, a patch will be created between the transplanted hairs which remains permanently and then the existing hair which gradually recedes back, because of which this patch will give an awkward look and it will not be natural. So I suggest to not undergo hair transplantation at the early ages of baldness and try to save the existing hair. In people who are more into professional where they are in media or actors where a front hairline correction is very important, according to their profession, they can decide and go for the hair transplantation. Ideally, to give a natural result in males, some receded pattern should be there to give a natural appearance. If it is created a very straight lower hairline, it looks like a female hairline and it is not natural for their face. If you are not able to take care of your existing hair, then the baldness will further progress and only the transplant hairs will remain, which will look awkward. Now, undergoing hair transplantation in the frontotemporal angle at a later age, for example after 35 or 40 years, they would have developed some amount of baldness, and their receding hairline, if there is minimal, they may not progress into a very rapid baldness. Depending on their age and progression, we can analyze and tell you. So this kind of later age, if you are doing some amount of transplantation in the hairline correction, frontotemporal angle correction, this will look better, and according to their age it can be designed for their face. So we take measurements according to the face. There is a bone structure, their eyebrows, their face structure. Based on that, we create a hairline. This gives more natural look. We have seen even very popular actors or media persons who underwent hair transplantation where it has gone wrong in some cases, where the hairline is too straight and very artificial look is there. So you'll have to also think about a natural looking hairline, which once it is done, you can't reverse it back. So you'll have to select the correct hairline for this area. Any doubts is there, we'll be able to help you with that.